On July 15th, the Centers for Medicare and Medicaid Services issued a proposed rule to strengthen Medicare, but also implement some lessons learned from COVID. It's a rule that's proposed annually, and this year it's called the Calendar Year 2023 Medicare Hospital Outpatient Prospective Payment System and Ambulatory Surgical Center Payment System Proposed Rule. This year, in addition to proposing payment rates, the rule actually includes some proposals that align with the Biden administration's goals on health equity, especially in rural communities, and competition. More specifically, the proposed rule includes improved payment policies for rural emergency hospitals, a new designation of rural emergency hospital, payment for remote behavioral health services, some enhancements for N95 surgical masks, and a request for information on competition. And we'll look at each of those quite quickly. The proposed rule establishes payment policies for, like we said, that new designation of rural emergency hospital. The administration says this is going to improve access to care in our rural communities, especially after the last several years of the COVID pandemic. It includes higher payment rates for these rural emergency hospital services, expanding coverage for certain outpatient services, and other additional enhancements. It also includes some payment for certain behavioral health services to be provided remotely as covered outpatient services. What it's actually doing is taking some of these remote behavioral health services that were allowed due to the COVID pandemic under waivers and extend that flexibility after the eventual end of the national public health emergency, whenever that may be. Let's talk about the N95 respirators. The proposal includes additional payments to account for additional costs of domestically made surgical N95 respirators, and the administration says this is just to be prepared for any future COVID use or future pandemics as they may arise. There's also that piece on competition, like we said. There is a request for information about enhancing transparency and competition in the healthcare system, and the feds also want some feedback on some data they released back in April on mergers, acquisitions, consolidations, and ownership changes for hospitals and nursing homes enrolled in Medicare. Now, this is a proposed rule. It is displayed in the Federal Register with a 60-day public comment period, which will end on September 13th, 2022. The final rule is therefore expected in early November 2022. We link to the proposed rule in the description below, along with instructions on how to submit a comment.